Welcome to our video on what you need to know about tinea skin infection. If you have been diagnosed with tinea skin infection, you may be wondering what your next steps should be. Here you'll find information about dry tinea, inflammatory tinea, red-purple nodules, and treatments with antifungal pills. These treatments may work quickly, but they often leave a noticeable discoloration on the skin. Some people will need months to see full resolution. If your symptoms persist even after treatment, you may be a candidate for surgery or prescription antifungal pills. Inflammatory tinea. If you're experiencing unusual patches of red skin that look like Christmas trees, you may be suffering from tinea versicolor. A similar skin rash, called pityriasis rosea, can also occur. Unlike tinea versicolor, pityriasis rosea isn't contagious and is treatable with over-the-counter or prescription medications. However, if you notice these patches on more than one part of your body, you should get them checked out by a medical professional. Symptoms of inflammatory tinea skin can range from mild to severe. The most common form is erythematous granuloma, which is usually accompanied by red margins. If left untreated, the lesion may progress to an abscess. Treatment for tinea corporis depends on whether the fungus is active or not. Treatment usually involves antifungal medication. Some cases may be refractory to antifungal agents. One patient with tinea pedis presented with blisters on her left palm and forearm. She also experienced lymphangitic streaking and a fever. Blisters continued to appear, and the patient was afebrile. Her thenar eminence was crusted with vesicles and the surrounding erythema extended onto her forearm. Bacterial and viral cultures were negative. Tinea corporis is another form of inflammatory tinea skin. This dermatophyte infection is usually characterized by a red rash. These lesions are typically surrounded by an inflamed border, and they appear as round, ring-like lesions. Normally healthy individuals will have one or more lesions. Those with decreased immune responses are at a higher risk for more invasive infections. Dry tinea of the head. Dry tinea of the head is a type of fungal infection. It most commonly affects the head and lower extremities and is common among adults assigned male at birth. It is usually characterized by red-purple nodules and small violaceous papules, which can be up to 2 cm in diameter. The disease is also highly painful, and the primary symptom is the presence of an ulcer. A physician may recommend antibiotics or prescribe a special shampoo, which can kill fungus. The most effective treatment is usually an antifungal medication that is taken for weeks or months. If the symptoms don't clear up within this time, you may need to repeat the treatment. Medications can help but are not a permanent solution. To keep the infection from reoccurring, you should avoid public showers and avoid barefooted areas. If you suspect that your child has dry tinea of the head, a physician may perform a fungal culture to confirm the diagnosis. To perform a fungal culture, your healthcare provider will scrape a sample from the scalp or pluck a few hairs. These samples are then soaked in a code 20% solution and examined under a microscope. Some infected areas will fluoresce under a Wood's light. If you suspect your child has a tinea infection, your healthcare provider may prescribe terbinafine or a griseofulvin-based drug. There is no cure for dry tinea of the head, but it can be treated. Treatment for this type of infection usually involves antifungal medication and good hygiene. The fungi that cause the infection are very persistent and shed spores for months at a time. Therefore, it is important to regularly check household contacts and use antifungal shampoo. Infection can also spread to teachers, so it's vital to educate them about the symptoms and how to avoid them. Red-purple nodules. A physician may prescribe an antifungal medication if the red-purple nodules are resistant to topical agents. Such medications may have side effects but can be helpful in treating the infection. The best treatment for the condition depends on the cause of the disease and the severity of the symptoms. Treatment can include a change in diet or skincare, but the most important aspect of treating this skin disease is prevention. Tinea corporis typically presents with a well-demarcated plaque with a raised leading edge. It is difficult to diagnose if it is accompanied by a history of medications. A dermoscopy examination is an excellent non-invasive diagnostic tool. Microscopic examination of skin scraping can also confirm the diagnosis. Clinical examination of the skin is the most common means of treating this disease. Diagnosis of tinea depends on the clinical presentation. Unlike psoriasis, tinea symptoms do not have crusts, vesicles, or ulcers. In addition, psoriasis do not have a thick, trailing scale around the margin. If you notice any of these characteristics, you may have tinea. If you have any questions, please contact your doctor. Another fungal infection is granuloma annulari. This condition occurs most frequently on the feet and ankles. It can also occur on the scalp and in the groin area. For treatment, a physician should prescribe a fungicide medicine that is effective within 72 hours and should be continued for 14 days. If the nodules are accompanied by an odor, the doctor should take samples and recommend antifungal pills. Treatment with antifungal pills. Tinea skin infections are generally caused by a fungus called Malassezia. This species of fungus is normally present on the surface of the skin. Clinical disease occurs when the fungus changes from yeast cells to pathogenic mycelium. This transformation is thought to be caused by external factors such as excessive sweating and use of topical skin oils. However, poor hygiene is not a cause of this infection. It is best to seek medical attention as early as possible if you notice the first symptoms. Treatment with oral fluconazole twice a month will help limit recurrences. While treatment with oral fluconazole is not a permanent cure, the skin tone may lighten temporarily as the yeast dies off. This usually takes weeks to months before it returns to its natural color. However, the good news is that the condition will gradually clear up. Fortunately, there are many treatment options available for tinea skin infection. Home-based treatment options can be effective, but it is important to consult a dermatologist before taking a course of antibiotics. A doctor may prescribe topical creams, oral medications, or a combination of the two. This can often be a less expensive option than visiting a dermatologist. Treatment with antifungal pills for tinea skin infections is a great option for symptomatic relief. Although topical antifungal creams are effective for reducing tinea skin infections, antifungal pills may be recommended for severe cases. Oral antibiotics may be used if the skin rash is extensive. However, the fungus may come back after a few months. Because this condition is a chronic infection, you will need to use oral antifungal pills for tinea skin infections if you're concerned about the long-term effects. Prevention with dandruff shampoo. Treatment of tinea skin with dandruff shampoo is the least expensive way to get rid of the rash. Antifungal shampoos that contain selenium sulfide can help treat the skin condition. It is best to use these shampoos for several minutes per day, once in the shower and once again after you've dried your hair. If you don't notice any results after using these shampoos, you may need to seek medical attention. Although the rash disappears in most cases, it can reappear in warm weather and require a stronger medication. Medicated dandruff shampoos may also be used to treat tinea skin. You should apply the shampoo over your whole body in the shower and leave it on for a few minutes. For optimal results, you should use these shampoos once a day for at least 4 weeks. If the problem persists, you should consult your healthcare provider or dermatologist. If you can't find suitable medication for tinea skin, ask your healthcare provider to prescribe an antifungal cream. Miconazole is an effective medication and can be used for 7 days to clear up tinea skin. There are over-the-counter antifungal shampoos that contain selenium sulfide to treat tinea skin. The best antifungal shampoos will be dandruff-friendly and may contain a dandruff-fighting ingredient. Medicated shampoos may also contain selenium sulfide. However, they are not enough for treatment. The infection may recur in the short term. Thanks for watching. Please like, comment, and subscribe if this was helpful.